Perfect. Hello, my name is Aisha. As Beth said, I am part of the Young Adults panel at D1 Now Yeah, which is a reference panel at the University of Galway. So I have been living with type 1 diabetes in 2 days' time for 19 years. Um, and I transitioned from pediatrics to adult care about 3 years ago. So my transition first and foremost happened when I was 18 and I was done my leaving cert. So I know that's different at various for various people, but I was lucky that I was able to stay in the service I was at with the care that I was with the team that I was with until I finished my leaving cert, and then I transitioned to adult services. I'll go a bit backwards to look when I was about 15, 16. So I was in Tala for, and Helen will speak to you. She was part of the team there, and they offered an amazing service where we sort of, before actually transitioning to adult services, we transitioned to teen clinic, where we were given that sort of support, knowledge, and training just in ourselves and our skills to take a bit more ownership over our own diabetes care in our daily lives. So for diabetes specifically, that looked like information on sick days, information on drinking, driving, and the likes of smoking, pregnancy, whatever that those sort of big topics. And we had those conversations a bit early on, and but they were good conversations to have so that you had that knowledge and awareness. What was interesting about those sort of information sessions was that it was only with other young people. Your parents weren't in the room. So you could, take that information in and ask any questions if you could. And I think that allowed for a bit of honesty. Because you could ask those important questions that a lot of kids won't ask in front of their parents. But again, it sort of signified this moment of your parents aren't in the room. It's now sort of a bit up to you. But your parents are still invited to the appointment. So you still had that support, but it really just did signify that, you're becoming an adult moment. So that sort of carried on for about 3 years. So for me, that would have been TY fifth year and sixth year. And then I think at my second last appointment, I would have sort of been told, like the next appointment is your last appointment. And afterwards you will be moving to adult care. But I think at that point, we really started talking about what that transition looked like. Like your care, in my case, my care team was still available for me to contact if I had any concerns or worries or needed anything diabetes related until I met and had my first appointment with my adult team, which gave me a lot of reassurance. Um, I don't know what illnesses your children have, but I know with diabetes things can go haywire in the matter of moments. So it was nice to have that assurance. When I finally moved to adult care, I was in my first year of college, so it was quite a hectic time in my life. It was quite a new time, and everything felt very new to me. It was the first time that a parent hadn't attended an appointment with me, and my parents didn't attend an adult appointment with me up until actually my past appointment. So I went for the first 2 years by myself. And that was more the fact that I was in college and I was commuting from college to hospital rather than my parents didn't care or anything like that. It was just the logistics of it. Um, but I was again lucky that my parents did call before and after to like make sure. I was like, how's your HbA1c, or how's this? How'd the appointment go? All of this, all of that. Um, that first appointment was a tiny bit daunting because you were sort of in the room by yourself. You were sat there by yourself. There was nobody to sort of turn around to and have a chat with, or like just the little bits and pieces. So your child may want you to go to that appointment with them. If you can, that would be great. But I think it's a nice thing to maybe ask if they would like you to go. If they would like you to go, and if you're available to potentially support them that way. But that first appointment, you sort of went through new nurse. I think the thing that struck me was that I kept getting introduced to new people that I've sort of never met up until I had my consultant appointment. And I'm lucky, I say, that my service we had for the first 2 years your old consultant, so your consultant from pediatrics and your consultant from adults were in the same room with you. So that was a bit of familiarity, and so were your nurses. So that was really, really nice. It wasn't you were just thrown out into the big bad world alone. Um, so we had that sort of moment with, the met signified. I think that was the big thing. You were now introducing to a new team and your care was being handed over. You were also now sort of told what the system, very briefly, not very much in detail. So, but you were told like this is how it sort of works in adults. This is what you need. These are the new contact details. I would say that I think once you get to adults, a lot of things become very quick and very brief. So it can be very hard to take in that information or really sort of digest it, especially when it's your first appointment and whatnot. But it's important to really get those contact details to know who to call or who to email when you need anything. That sort of was my thing. So I went to my second appointment, went to my third appointment, went to my fourth appointment. And it was just that I think the big thing with adults for me was that every time I was meeting new people, except for my consultant, um, so I had no clue who it was, but I think by that point just got very used to it. Because I was in college and away from home most of my day, I'm very used to managing my own diabetes. And I know that's not the case for every child. So I think when you finally sort of move on, there's no more like hand coddling or even just reinforced support. By reinforced support, I mean there's nobody sort of checking in on you or checking up on you if you miss an appointment or if you don't do this. It's very much like there may be support out there, but you sort of have to maybe jump a hoop or two to get to that support. And something that I realized really quickly was that, the multidisciplinary team in adults is there, but they all work different hours. They work cookie hours. So if you're in college, you may not actually be able to get them when you want to get them or when you need to get them. So if you actually need something, you need to contact a week, 2, or maybe 3 in advance. That sort of last minute email, which would have worked maybe in pediatrics, doesn't work in adults. It's sort of a lot of the ability to access your healthcare professionals and your team that becomes very different in adult care. Um, and if you are a young person who needs that reinforced support, I think that's where your parents come in. Again, I'm very lucky. My parents have been sort of involved in my diabetes for like 17 years before I transitioned to adult care. So they had a really good handle on the diabetes and the sciencey part of it. But I think at that point it's not just the sciencey part, it's more just the emotional part because you have to now like be the person to instigate those conversations and send those emails. But it is nice to know that someone's going to listen to you vent about your diabetes. Because that isn't something you get in adult care, really. My last appointment, my mom went with me for the first time, so that was nice. She was like, "Oh, I'm gonna come along." She had a day off work, so she came with. I think I found it quite nice. It was nice to sort of be in that appointment with mom. Um, I think sometimes parents can think about things. Like again, I'm really busy with college and stuff, so sometimes she'd be like, "Oh, why don't you ask about that? That showed up last month," like something like that. So I think your parents can sometimes notice things or remember things to ask that you as a young person have just completely forgotten about. So that was quite nice. And your parents can also be advocates on your behalf. I think when you're in adult care, that can be quite a, a scary time. Not a terrifying time, but it's just scary because it's unfamiliar. So that was quite nice, and it was just nice to have her there. And I think afterwards we went and grabbed a cup of coffee, so that was nice. It was nice to sort of process afterwards. What I would say is my experience personally in transitioning has been quite positive, but I think it was more the fact that I felt like I was prepared in pediatrics to transition to adult care because adult care doesn't, like, again, as I said, we did have that transitionary period where you had your pediatrics and your adult team together, but it was just your consultants and your team. for 5-10 minutes. But adult care as a whole is a lot of responsibility, and it's a lot of responsibility on the patient to become their own advocate. And so having a support system or identifying what the young person support system is prior to transitioning is a really good idea. And knowing who your contact details are and where to reach out to support if you do need that additional support from your multidisciplinary team would be sort of my advice for parents, because that is one thing you can do to sort of take one sort of burden off the child. But again, it's important to support your child to transition, because they are going to hopefully head off to college and hopefully get a job and hopefully be a bit more independent in living their best life with their illness. And I wouldn't want that they can't do that, because I've been living my best life as a that very so that is me. Thank you for listening.
That's brilliant, Aisha. Thank you so much for sharing that. Well done, and right on time. So just going to hand over now to Helen Fitzgerald. She's our next speaker. Helen is an advanced nurse practitioner in pediatric diabetes, working as part of the pediatric multidisciplinary team in CHI Tala. And she's going to present the model of practice transition care they provide there in the diabetic department. And yeah, when we had the Lekela conference, that was a beautiful surprise. I don't know if you want to explain that for a minute, Helen, but yeah, I'm handing you over to Helen now.
Hello, how are you? I'm delighted to talk to you this evening. Great opportunity to get word out there and raise the importance of transition. Aisha, our first speaker, hard to follow her. She's a hard act to follow. She did an amazing job once again. I've heard her speak only recently at Lekela, and she has done us proud once again. That was a huge surprise the last time I was there. You know, on my interest in transition, and Aisha had no idea she was going to be talking, so it was lovely to hear the successful transition. There's work to be done though, and huge work to be done both at our own level, and we're always trying to improve the process and make it more relevant, because it's ever changing. And I suppose that's nationally, it's everywhere is trying to improve transition process. I suppose for the people attending this evening, from what I can gather, I'm talking to people who are in the process or who have made it, parents and adolescents. So it's varied with varied conditions. My expertise is in diabetes. I am not a transition expert, and I won't claim to be, but I have a lot of experience in transitioning young people from pediatric diabetes to adult services. And I know all conditions are different and have different, what's relevant is different in each of them. So I will try as much as possible to talk in general, though I think a lot of what I have to say would apply for any condition that might be, that you might have. Ruby has slides there. I have just a very quick few slides. There are only 3. And they are, they're divided into 3. I suppose how I divided it is just to try and simplify the process, but I'm thinking ahead, and thinking ahead is starting quite early. Then the second slide is going on to being prepared on the day when you get that appointment, what you need to do at that stage. And then my third one is how we're going to nail it. To your best ability, and nailing it is going to be different again for everybody, and everyone has different expectations, and as in a different journey basically. So we might move on to the first slide then. Ruby, please.
Sorry, technical difficulties as usual. Classic. Let me redo it.
By the way, before I start on that, don't be afraid to shut me up because I can get carried away sometimes. So don't be afraid to tell me time is up.
Okay, let's try it again.
Yeah, there we go.
There you go.
Okay, so in putting this together, I was trying to simplify it, trying to make it a not too busy slide, although that looks quite busy. But what are the important things to start thinking about? And when you start thinking about these is varied again from person to person, but it can be anywhere from a couple of years really before you actually move. And the thinking ahead is really starting when adolescence starts, because the young person is taking over their care to adulthood, you know, that they want to be in full control and command of and making decisions about their condition. So we're encouraging that at clinic. You're encouraging them to ask the questions. You're talking to them, not the parents, as they're getting bigger, obviously including the parent, but you know, the condition is the child's condition, and they have to be, you know, it has to be directed at them. So that's changing as the child is able and is getting involved. And again, you know, an adolescent with an additional needs is a different story as well, and you have to take that into account, that the whole process moves much slower in that situation. So the parent has to learn to step back, allow the child or the adolescent to talk and to ask their questions, and to learn from the experience of clinic, because every clinic visit should be a learning. You know, they should come away with something of use and that they've felt more informed. The young person's taking ownership, asking their question, but parents knowing when to allow them to talk and when to prompt them or when to ask their questions. And different people, you know, have a different style. You know, no two people and no two medical people are going to have the same style of how they're interacting with, you know, the family. So, you know, that's about us being aware and be involving the young person more and more. And that really, we need to be reminded of that and remind each other of that at clinics. In our situation, once the adolescents reach 5th and 6th year, yes, they're in an adolescent clinic then, which means the child or the young person is encouraged to see the doctor for a while on their own. The parent can then be involved at the end of that clinic visit. And that's for the average. Some of the adolescents, young people will not want to be in with the doctor on their own, and that has to be respected. That is not an issue. But the idea is that they take more ownership, they'll ask their questions, and when they're asked a question, that they're thinking about how they're managing and how they could manage better, be it or whatever. So that is the changing roles. And some parents can, you know, evolve into this role very naturally, but some don't. And some do need encouragement to step back and to need guidance. And I suppose that's our role there, is knowing those parents who need a bit of guidance in that, and, you know, talking to them separately and saying, look, you must allow them a bit more independence or whatever. And we're doing that on a regular basis. But as I say, for some families, it happens very naturally. But for a lot of people, they need a reminder that actually, you know, you're not in the driver's seat anymore. You must allow this young person to take the driver's seat, or even, you know, join them as co-pilot or be in the back seat, whatever way they want to. Once it's all supportive is the most important thing there. And what's supportive for one is not, it can be different to another. So there's, as I say, you have to assess each situation. So we're thinking ahead. So that's about the roles, but then we have to think about, you know, paediatric service is going to end. We're not always going to be a child, a young person. We're going to be an adult. And what is available to you for your condition? For some people, if they're down the country, you know, their choices might be quite limited from a logistics point of view. In Dublin, it can be, you know, can be a bit more choice. But it again depending on the condition, that is quite varied. But you know, you can gather this information, and places you can gather that information are from support groups, if there's a support group for your condition. Other places, you know, people are very good at Googling now, and ChatGPT, there's a huge amount of information out there, and use those resources as well to find out about what is, you know, what is in your area or what is out there. Do ask people who've gone before you, would be another bit of advice. You're not the first person to transition with this condition. There's plenty of people have gone before you, have traveled this road. So, you know, meet these people and go to places where you know you will meet them. You're not going to meet them at home. You're going to meet them if you go to what's put on for you. For example, with Diabetes Ireland, they're regularly putting on workshops. They're putting on all sorts of webinars. They're putting on information evenings. They've conferences. That's just an example, but there is, you know, these kind of things are in other conditions as well. And that's where you're going to meet like-minded people who will have traveled that road. And, you know, the questions you might put to them are going to be varied again on what's important to you. Is it location? Is it accessibility? Is it what the adult teams have to offer? And again, depending on what the condition is, you know, having, for example, a dietitian would be very important, and a team with diabetes psychology would be very important. But it might be OT, physio, various multidisciplinary team members, and some, you know, some teams are better resourced than others for whatever reason, and whatever, you know, so make sure that whatever team you're going to has what you need. And again, then you're going on, you know, has this team got a good reputation? Again, you'll find that out. Ask your current team who they're linked with, what they might recommend. You know, there's lots of people that can guide you. You may not always be getting the answers you want, but keep asking the questions and think well in time. It's no point thinking of this, you know, 2 months in advance of moving to adult services. It's too late. You need to start thinking of this long before that. I think we might have said enough on that one. Will we move ahead to being prepared? Okay, so we've made the decision. We've decided that it's a good idea to go to the local service. It's got what you need. You know when their clinic days are. You know how you're going to be able to get there. It sounds like the right option, and your team have confirmed that as well. And now you've been issued an appointment, and generally you'll get about 4 to 6 weeks notice of an appointment. And again, have a look at that appointment, read the letter fully. I think people look at a date on an appointment and they don't read the text. I think particularly when you're going to your first appointment, you do really need to read that text. There's information in there on where it's located, which again is important. The time is important, obviously the date, and if you look at it first off and you know you've some other major commitment on that date, well then you do need to reschedule. However, first point there is prioritize your appointments. Adult clinic visits are less often than pediatric ones. I've heard some situations where it's yearly, but at most it's probably about twice yearly for most chronic conditions. So do your best to prioritize it, I would say. And if you cannot make it, it's really not, or you got sick on the day, whatever that might be sure to cancel that appointment. Don't ignore it. If you're not able to attend, you're not able to attend. You free up that space for somebody else. If you don't cancel it, it's a lost space, and there's a team there. You know, it's a big commitment from all the team to be there at a clinic, and the appointments need to be filled. So it's really appreciated when you cancel your appointment if you're not able to attend. The other very important part of that is that a lot of adult clinics, if you don't attend, it's referred to as a DNA, did not attend, and their policies vary on what they do when they get DNAs. For some, it's if you get 2 DNAs, then you're out, you have to be referred back in. That would never happen again in paediatric services. But it does happen, and be aware of that, you know, you will be, you know, you're not attending a few appointments, they'll consider you're not interested in going, that you've gone to another service perhaps, or you've left the country, whatever, they're not going to keep rescheduling you. Plan your journey, know how you're going to get there. You know, are you getting a lift with a parent or whatever? Are you driving yourself? Know where the car park is. You know, Google Maps is good, but again, there can be confusion on the day. So give yourself plenty of time to get there as well. Again, attending alone or accompanied, that is up to you. And Aisha said there, yes, she has done both, appreciated being accompanied. There's mixed feeling on that with people, and adult services have been used to they're quite used to seeing people on their own, and sometimes can go, oh, you've somebody with you, you know, there can be a bit of a reaction to that. So be prepared for it. However, I think that's changing, and I think you're perfectly within your rights to have whoever you want there, be it a parent, be it a partner, be it a friend, and whatever, you know, is most supportive to you, and whatever makes the whole experience best, it's your choice. Nobody can stop you having somebody with you at your appointment. Know or bring a copy of your prescription, or know your medication, or take a picture of it, whatever is going to work. But if you want a prescription filled, you need to know what you're on. And again, from a diabetes point of view, you know, there's a huge range of medication for all sorts. So nobody is going to know what you're on. So make sure you bring your medication list of your medications with you. That's very important. Know your medical history as well. You are going to be asked questions. They're seeing you for the first time. They're going to ask you when you were diagnosed and when you started whatever treatments, and anything relevant in surgical history, medical history, birth history, whatever it is, and family history, of course. Again, that may be very relevant for your condition. So sometimes, you know, for young people transitioning, that might be the first discussion they have with their parents, is about family history and that side of things. Do write down your questions, and don't feel a bit bad about pulling out a notebook or your phone with your notes, or whatever it is. It's a stressful situation. It's a new environment, new people, you know, you're going to forget everything. So do have your questions, and get what you need from that appointment. You know, make it worthwhile, because the more prepared you are, the more questions you have, the more you're going to get from it. I think I've said enough on that one. So now we're going to nail it. And again, it's about being prepared, knowing what to expect. And again, if you've been transitioned by your paediatric team, they will have talked you through a lot of it. The environment will be different. You're not going to be seeing other kids running around. You're not going to be seeing toys. It mightn't, you know, the appearance is going to be different. It might be much nicer. It, you know, might be more spacious, as in the case in Tala. I know the adult service, it's much newer looking. The whole clinic situation can look nice as well. It doesn't have to be all kid. It is not going to be kid friendly. The people waiting, you may see a lot of older people, which will be unusual for you. There may be bigger numbers in the waiting area. The clinic may be busier, may not, but be prepared to wait. You know, don't be giving it, oh, I have to be in and out of here in an hour. You know, you're going in like that, you're not going to nail it. You have to give it the time. And expect, you know, it to take a longer time, and then you might be pleasantly surprised. Get to know the team. So, you know, you're meeting new people, but they're meeting new people as well. And it's up to you to get to know them just as much as it's up to them to get to know you. And don't be afraid, you know, make a connection. And that's what they will remember, the ones who do make an effort. You know, you're coming in and you're staying all quiet. They're not going to remember you the next time because you didn't say anything that, you know, so do even look at their name badge and make a connection that way and say, oh, I see, or, you know, if they don't introduce themselves, you know, make a connection in some way there. They might even ask you about your previous clinic and have connection, know people that have looked after you before, make whatever connection works. But do take the time to, if you get a chance, put a face with a name. And that can be really helpful if you're making connection with them again between this and the next visit. Because then you say, oh, I met you at clinic and I'm Aisha, or whatever your name is. It's always good to put a face with a name, and they're all getting to know you as well. And that is just because there's bigger numbers, it's going to take a little bit more maybe to stand out, and we can stand out for positive reasons as opposed to negative ones. Ask your questions. I did say that, and being prepared, having them ready, but don't be afraid then to ask them. It's no point having them written down and coming out and not having pulled out your questions. So do ask them, and don't worry about them sounding stupid or whatever. They're not. They're all going to be relevant questions. And advocate for yourself. You know, it's your diabetes, it's your whatever other condition, what epilepsy or whatever it might be, it's yours, and you want it to be, you know, blending into life and not taking over. So you want any help that's out there for that. So if it's a different treatment, if you think you should be on something else, if you've heard about something new, discuss it and bring it up. And patients now are very, very informed. You know, we have so much resources at our fingertips, and you can access information and have more information on various aspects of your condition than the person in front of you at a clinic can have, you know, depending on how much you want to know about it. But there's lots and lots of information out there, and anything you find out new that you might think would be applicable to you, throw it out there, ask it. It's all good. Before you leave your appointment, do you have what you've got? You have questions to answer, you might have a prescription to be filled, so make sure you get that. The prescription is important. If you don't get your prescription filled, well, then a month later your pharmacy tell you that your prescription's out. Then you have to go to a GP, because, you know, again, not like the paediatric service, you're not going to be entertained looking for prescriptions in between visits, and it's good to know that. It's just too many numbers. They can't keep up with that demand. So get your prescription before you leave, I would say. Get the contact details as well. Know who you need to contact in an emergency from the time of that appointment. Between one appointment and another, if something happens, and most chronic illnesses, you know, there can be emergencies in between or whatever. Who do you contact? You know, what's the procedure if you came into A&E or whatever it might be? You know, and bring those contact details. Don't, you know, have them use them. Most clinics now do work through email as well as phone, and email can be a very good way of accessing services. Yeah, so I think we'll nail it if we've it all thought through. If we don't give it any time, then it will backfire and you will feel unsatisfied. But you can do your part to make it the most positive experience. And the best of luck to any of you who are doing that right now or in the future. And thanks for taking your time to listen this evening.
And thank you, Helen. That was very informative, very practical, and yeah, lots of examples, and the visual was brilliant as well, like really very strong, like image. So thank you so much, Helen.
Welcome.
Let me introduce you now to Jason, or Jay Dunn. He's the father of Orla, and he's going to talk about his experience with his daughters transitioning to adult services.
Good evening, everybody. I'll try and keep it as quick as I can because generally, when you start speaking about your child, I know it's with myself, you can kind of get caught up and you will go on and on and on and on. Um, my order's 19 now, and realistically, over the last year or so, we've been transitioning to the adult services. So, it's been quite difficult because Ola has neurological conditions as well. She's hydrocephalus, she's epilepsy, she has cerebral palsy, global development delay, cortical vision impairment. You could go on and on. She has a list, but luckily for Orla, Orla's been a mainstream school, and she's been fairly good, I suppose, as far as the services have been provided. And it probably will be down to us as parents because we don't let anything go. I gave up work about 17 years ago now to take care of Orla. She was 2 at the time. Yeah, she was 2 at the time. So yeah, for me, it's been a difficult road. But when you can get it all together, you see the benefits for your child. You see, like I see Orla now. Orla is she's exceeding herself now. She's taking more decisions herself. She's making more of an effort herself. But unfortunately, unlike yourself, Alicia, Orla wouldn't have the mental capacity to be able to make the decisions and have that kind of independence that you have. So me as our guardian has to make a lot of decisions for her, and I have to go into appointments with her, or my wife goes into the appointments with her. But as I said, it is difficult to make the transition, and if you don't know, you have to look for stuff like, or started a course in a place called the National Learning Network, which, and believe it or not, the course is called Transitions. So it's basically to take him from from being a child to an adult and getting into the work situation and what have you. But we were struggling because I'm a school bus escort, so it's struggling to get her to the where she needed to go. And we didn't realize there was she could get a PA. So she in the morning she's a PA for an hour and a half, and the afternoon she has a PA for an hour and a half. So that PA brings her to her course and brings her back. But we didn't know about that. It was just a parent like that. We just were discussing stuff with parents. We were, worrying about what we were going to do. And I just happened to be over in Enable Ireland and got speaking to one of the parents, and they said, sure, this PA is available. You just have to apply and you have to chase them. But, a lot of information is not there for parents. You do have to look, or like myself, speak to other parents or pick their brains about stuff in order to age your child. As I said, I'll go again. Aisha's lucky. She goes to college. I'm sitting here listening to you, and it's amazing listening to you. You've come so far. Well done, you. Um, but some of us don't have that, unfortunately. Our children, like Orla, is probably about 14, 15 maybe, as far as our thought process is concerned, so, but she is starting to catch up. She is making the decisions herself. She's doing a lot more independent stuff. And with the PA now, has been great that she has helped an awful lot, which has been brilliant. As far as medicals are concerned, Orla would have a neurologist, a neurosurgeon, and then you'd have endocrinology and stuff. So we had to go to Beaumont because that really is the best place for the neurological stuff. But unfortunately, where we are, we're in Salons. If anything happens, or she goes to Nice, but all of our appointments are in Beaumont, and that's where we go because it's the best place to be honest, as far as neurological is concerned. But when she was attending appointments for as a child, it was Temple Street. All our stuff was in Temple Street. So and I have to say Temple Street were brilliant. Any information you needed, you got. Again, you have to ask, you have to pursue it. Sometimes you can feel you're banging your head off a brick wall, but you have to keep at it and at it, unfortunately. And that's just the way the system is. Like, fair play to Helen and Ruby here, they're professionals in the field there. They know what they're talking about, and it was great listening to Helen there. What you're setting up and what have you is brilliant. But unfortunately, some parents don't see it and don't notice there is stuff there. They don't know there's stuff available, and it is quite difficult to get it out there. And it is only, I think, through talking to other parents or looking at the news or whatever, like what they're pushing for, is the only way, another way, really, in the major way of getting the information that you need. Um, as far as the transition is concerned from Oregon, from adults or pediatric adults, it's actually been pretty good, I have to say. But again, it's down to, planning. You have to plan ahead. As I said, I was talking with myself, Bess, and Ruby were talking just before we come on here, and I was saying everything was easy. Orla went to had a nurse in preschool. Then when she went to primary, that was an easy transition over, and then transition to secondary, that was quite easy as well, and everything kind of worked into place. But realistically, the only reason it worked, it was the work that we put in as parents. We do an awful lot of work, and you don't recognize the amount of work that you do as a parent. And and realistically, you need to. That's one thing I would highlight to you is remember yourselves the amount of work you put in. And even only the little things, making the dinner, putting on, tucking them in, whatever it is, it's all these little things add up. And I'd be fairly dogged as far as looking for stuff for ours concerned and pushing her and giving her the best possibility of a good future for herself. That's your job. That's what you can do, and the only thing you can do. And as I said, we're at a stage now. I'm at a stage with all of that. I can't really bring her any further now, and that's when the peer groups, you're talking there, Helen, about going into the appointments by themselves to speak to the specialists themselves and what have you. And we're trying to push that as well. But when she comes out of the appointment and you say, well, how'd you get on? I was grand. And that's the end of it, So realistically, you're there going, well, what happened? What medication? Like, you're talking about medications, and like orders on several medications because she has epilepsy as well. So it is mad. And it's great to be able to give him that independence. But unfortunately, with me, what I've had to do is I've had to follow up with emails or phone calls or whatever to get to the information that I suppose that wasn't there, or the questions that weren't asked. So that's one thing I would be aware of if you are trying to get your child to be an individual and have the maturity and stuff and moving forward. That's one thing I would do, is make sure if you are doing that, to ask them questions, and if they don't have answers for you, to follow up yourself with the specialists so that you know exactly what's going on, if there's new medication needed or if there's new therapies needed or whatever. That's a step you need to take. And again, I will reiterate again, talk to other parents, get into the groups, whatever condition your child has, get into the groups that of the condition that the child has, because there's a lot of information there to help you make transitions and move forward with your child. Again, as I said, we've been quite lucky in a sense that we work as a good team here, and Orla's been quite lucky in that sense that even though we've an older daughter and an older son as well, and aunties and uncles and what have you, we all sing off the same hymn sheet. So it makes life a bit easier for Orla going forward. And one thing I will say as well is the PA has made such a difference to Orla, and giving her that independence, giving her the ability to ask for stuff, to get stuff herself, to realize that she needs, I don't know, she needs moisturizer, or she needs whatever. Like the PA is there, so we probably say to the PA, listen, this stuff is she needs or whatever, and Orla kind of looks and says, oh geez, I need this or I need that. She goes and gets it herself because she has her own money now, and because she has a disability allowance, so she gets that. So she said to buy her own things. Unfortunately for us, we have a library of books here. I reckon there's a guts of 200, 300, maybe 400 books here. That Carora is a bookworm and loves our books. But that's everywhere we go, she buys books. She goes on her own in Liffey Valley, we let her off, and she walks around, and 100% she's going to come back with books. And same if we go to the Whitewater, or if we went to Nice itself, we let her walk around. She's going to come back with books, and that's, it's something we've kind of accepted and go, okay, fair enough. And like, our favorite haunt for eating would be Eddie Rockets, as she calls it, empty pockets now, because it costs a fortune to eat there. So, that's the thing. But as I said, it's like you need to give them the space, but you also need to be aware that sometimes they need assistance. Going into these places, like for appointments, or if they're moving if they're going to college, like Isha, they're going to college. As I said, I've always in the National Learning Network, which is brilliant, something I would highly recommend. If your child can't go to college, or or anything like that, this would be something I would look at for your child, because it's been brilliant for all. As I said, there's so much involved in it. Like I took a leaflet home here today to have a look, and like to do health and safety, living life to the full, preparation for work experience, health and safety awareness, communications, nutrition. Like there's 12, 13, 14 other things there that they covered on it as well, which is detrimental to your child going forward. So I'm looking at time here now. I'll finish up. For us, it's been difficult, but again, planning is the main thing. You need to plan ahead. You need to see and have in your head what's next, or where are we going with this, or who do we need to talk to, or who do we need to see, or what's available there as far as services are concerned. And if you're not sure of services, contact another parent again, as I said, in that area. As far as like, we're in touch with Epilepsy Ireland, all as autism as well. So Autism Ireland, the same, she's cortical vision parent, so we had for the blind out to have a look, so we're always pursuing different avenues, and I think that's the one thing and will reiterate to everybody is know what's out there for your child, and know what's out there for yourselves, because you struggle too, you need help as well. And I would highly recommend, if you can, look at as much information and take as much information in as you can, and ask questions. So I leave it there. Thanks for listening. And I said to Ruby and stuff, if you need any help around, you want to ask any more questions, I'll be available. There's no problem there. So thanks very much.
Brilliant. Thank you so much, Jason. I think you've just highlighted the range of the amount of services that Orla needs, and that's a big difference as well, like moving from peds to pediatrics to like adult services, and highlighting everything you do. So thanks so much again for speaking tonight as well.
No problem at all, anytime.
Right. Okay, thank you. Now, Ruby is going to talk about the Stepping Up resource. So I'm going to hand you over now to Ruby.
Thank you. So I'm just going to share a little presentation that I did for the Lacala conference a couple of months ago. Can you see that? Yeah.
No.
No?
Yeah.
Yeah. Cool. Thank you. I'm just going to go through it. So basically, in 2010, Children in Hospital Ireland and Professor Imelda Coyne from Trinity College, she's a professor in nursing, did a bit of research on the transition period when moving from pediatric to adult healthcare, and as a result of the research that Imelda Coyne did, we came up with this, or we created this website, because there's quite a big gap, it would seem. I know we actually, very thankfully, Aisha and Jay and Orla seem to have had a relatively good experience, but I don't think that generally that is the case. It is like a really tricky time in a healthcare journey, and even more so for those with complex needs. But we hope that the Stepping Up website can kind of support you along that journey. So we have the website, which is steppingup.ie, and on the website you can download a physical copy of the guide, which is essentially the website in paper form. So it kind of breaks down the transition process into 3 distinct steps. The first one, as I think Helen mentioned as well, like you have to start thinking about transition from an earlier age than maybe you might think. So they kind of say to start discussing it from the age of 12, which might seem young because transition kind of happens somewhere between 16 and 18 years. But from 12 to really start speaking about it with your child, and kind of helping them become independent in age appropriate ways, and to learn about their condition, maybe some of their medications, and giving them responsibility to maybe be the one that remembers when to take medication and that kind of thing. So that's the first stage, between 12 and 14. Then stage 2 is the planning for transition. So that'd be more in-depth learning about your condition, different lifestyle factors that might influence your condition, becoming aware of how you might have to take care of yourself, given your specific scenario and your condition. And that is between kind of 14 and 16 years. And then the third step is the making the transition from, which is meant to happen from 16 to 18 years. But as I think people have mentioned here, there's not despite the national framework, and all the work that is going into trying to create a streamlined process, it doesn't seem to be the case. Every clinic, hospital, condition, kind of varies, and even some people, like Aisha mentioned, waiting till after her leaving cert, where there's a little lull after the chaos of the leaving cert. So those are the 3 steps, and each phase, in the guide and on the website, gives tips for that particular phase, and frequently asked questions that a child or parent might have at the different phases or stages of the transition process. And there's also information on specific information dependent on the age and stage. So for the first stage, there's information on becoming independent, or how to begin the start of being independent in your healthcare. And then in the later stage, for example, there's the advice and tips on your first visit to the adult clinic. I guess as well, because it's not a streamlined process, this resource is attempting to kind of empower the young person and parents in leading the transition process, because some people have experience where they might come in for their second to last appointment and not be aware that they're due to move, and so this resource is all about empowering people to start the conversation and the process of transition. So as well as all the top tips and frequently asked questions and suggestions and advice, at the back of the downloadable guide, there are resources that are useful when you're transitioning. So there's the transition checklist, checking off different, do I know this? Do I know who the contact details of my team are? Do I know what medications I take? There is a section where you can put in your medical history, which is very good for when you move to adult services. You might have a much bigger team. You might be meeting individual doctors who over and over again will want to know your medical history. And so it's good to have it in front of you in physical paper form, or not necessarily, but in writing. And there's a section for important notes. There's a section on questions you want to ask, so that you don't forget when you get to the appointment. And what else on the website? We have little video snippets. You can see the clips there of I think it's 10 different young people's transition stories. As part of the Lakela conference, though, we did get updated videos, and you might recognize Aisha and some of them when we get them up. Apparently these ones are a bit dated, but I don't know. But yeah, so there's videos and different resources from different different charity organizations like Epilepsy Ireland and Diabetes and that kind of thing. And yes, so that is the address steppingup.ie, where you can download the guide. We also have physical copies printed of the guide. If anybody from different organizations wants to request them, please get in touch with us at support@childreninhospital.ie, or you can call us on 087 143 1649. That QR code should go to the website, at least I hope it does. And yes, so we are actually also, because this seems to be a big topic at the moment, and seems to be one that people really struggle with, and it's very complex for a lot of people. I know the stories we've heard tonight have been quite positive, but it can be very complex and confusing and all that kind of stuff. So we're looking to make this information more accessible to people, and are looking at developing like an app for young people to download, where they can digitally keep records of their appointments or their notes or their questions that they need to ask, or the contact details of consultants or their medical team. So that is something that we're hopefully will have sometime in the new year. But yes, that's all from me, I think.
Perfect. Hello, my name is Aisha. As Beth said, I am part of the young adults panel at Do1 Area, which is a reference panel at the University of Galway. So I have been living with type 1 diabetes